Mark Newhouser from Barcelona for IS Global. Great talks. I really enjoyed them. But this is in particular for the first three speakers, because the idea all three of you proposed many things, what could be done. And I wondered to what extent you do also evaluation of the actions, because what I see quite often happening that there are interventions done, assuming that they're going to be good, but there is no evaluation taking place. And I wonder how you deal with that in the examples you gave. Is a formal evaluation taking place to see if they're actually effective? Are they better than we expect them to be good, but are they really good as well? Do they achieve what they achieve?
Sure, so I'll take that first. I would say that let's just talk about Fitwel, because that's where we've kind of brought all of this together. So I think because Fitwel is based on so much research, we're really saying that this particular strategy has already been shown to have an impact at a population scale on a particular set of behaviors, etc. So I think what is really important, especially when we're translating the public health research to the real estate community and to those building our spaces, is to really strong in saying that these strategies have already been shown to have a measurable impact on health at a population scale. So it may be that for your individual office or set of residences that you may be plus or minus what we've already seen from the research, that there is enough knowledge to say that this strategy is going to have a positive impact on these outcomes. And I think it's really important that we go to the real estate, my industry, with that really kind of strong message that there is a wealth of research that has been conducted already to show that these strategies are impactful. And yes, it's really important to continue to do the research and understand the granularity of the impact on different scenarios and so on, but we don't need to wait any longer to start actually moving this forward and implementing these strategies. So I think it's really important that, yes, we continue to evaluate, which we do. We do a lot of original research. We gather ridiculous amounts of data, and we can really start to see trends because of that, because Fitwel is a certification system, but it's really an efficient way to gather data as well. But I do think it's important to say we know enough. We know that having green space has a positive impact on mental health, on a heat island effect, on all of these things. So it's not really an answer to your question, but the time for action is now, and we know enough to move forward with this. So yes, we'll share our data. In fact, I have one of our public health people here. Yeah.
And I would just build on that I think there's been a lot of research done on the smaller scale and understanding, if you do one rooftop white or one street, what's the difference in temperature. We're starting to see now some really interesting work done. Louisville actually has a multi-year, multi-million NIH grant to look at a control group and other low-income neighborhoods and epidemiological studies on the health impacts of more tree cover. And they're planting full-grown trees now, 30-foot tall trees, in neighborhoods and tracking for 5 or 7 years the health outcomes for the residents to be able to get to that question. What we haven't seen is the neighborhood scale studies on cooling, and at what scale and level do you need to do all of these interventions to achieve Melbourne's goal of a 4-degree decrease in temperature. I would say, though, on the flip side, we've seen the counter research done now where we know we're losing 28 million trees a year in urban areas in the U.S. We know that our urban areas are continuing to densify and have more impervious areas. We know temperatures are increasing. We know that we're seeing urban heat island effect getting more extreme. We know we're seeing more people die. So we're seeing the negative impacts of taking the wrong actions. And now we're beginning to see the research come behind and looking at the widespread city-scale interventions.
Oh, I'll just add, there's sort of two levels, right? That first, in the primary focus is that city government essentially transforms. So can they make good on changing the investment paradigm and evaluating that is kind of the primary focus. The performance measurement framework for the city has changed around a well-being-oriented framework. And so it's kind of embedded that there's ongoing monitoring and evaluation of that. And certainly the outcomes in that framework are constantly being assessed. So ultimately, that's the end point, if you will. There are pilot projects, certainly, that are also ongoing to kind of rapidly prototype and evaluate. So that's also a piece of the puzzle. But I think the bigger question is, can a city transform and meet a different set of goals and objectives? And what does that look like internal to city government? That's being evaluated. And then ultimately, what does it mean for the well-being of residents? And that's being tracked on an ongoing basis. Yeah.
One point, because you were saying, for example, for green space and mental health, there's good evidence. It's true, there's good evidence, but most of the evidence, if not all, comes from cross-sectional studies, epidemiological studies, a couple from cohort studies. But actually, when you look at interventions, if you put in some green space in a place, you know, does it actually change mental health of people? There's very little evidence. And so for me, I think, you know, I'm not criticizing, I'm just saying, what you do actually gives a lot of opportunity to do intervention studies and measure before and after. And in Europe at the moment, we have a lot of interest in that. There's a lot going on. But if you look at the literature, it's really lacking this kind of evaluation, the effectiveness, you know, and because we have good intentions, we put it in. But there may be other things going on, unintended consequences. I mean, actually, there may be no change because whatever reason. I have no idea how much green space actually people need to make a change. So I think there's still a lot of questions out there. But, you know, I'm a great green space fan. That I just say, just go for
Sure.
it. But I still, from our community, from the public health researchers, I think there are great opportunities still to really look at, you know, for how do this intervention, do they really make a difference? And
Sure. No, I hear you. And we are 100% underpinned by the health research, right? So we value the health research. And I would say that there are infinite questions that we could continue to answer. And yes, more research is good, more evaluation. We have Fannie Mae as an evaluation partner now. Like, can you imagine that conversation? Fannie, let's measure health outcomes. So we value it supremely. But I think the point I was making is I don't want there to be a discussion of we need to do more research before we take action. I think let's take action. We know enough. Like planting a tree, does it? I'm pretty confident it doesn't have a downside. So it's, I mean, maybe it does, but maybe the positive outweighs it. I can think of a couple of downsides of trees. But anyway, there's enough research. There's 5,600 research studies. Like, I'm a developer, I am not a researcher. That's enough evidence base for me to say, let's do it, right? We've been designing our cities for cars for the last 50 years with no evaluation and no consideration for public health outcomes. So it's like, let's just change course. And yes, keep measuring, great. And yeah, more data is always good. So yes, any way we can support anybody out there with research, we are working with all kinds of people. And the development community wants more data. Like, it's not like they are saying, like, whatever, we don't care about research. They actually want the data because they will use it in their marketing campaigns. So there is a value from the marketplace also to wanting to be able to say, my building is going to reduce your stress and reduce your levels of depression. I mean, so if we're cynical for a second, they want it too. So plenty of opportunities. We would happily. Sarah, my colleague, is here from the public health side of our organization. We would love to talk to you later.
We have actually a question here from Gina. Thank you. Hi, Gina, computing at Drexel. So I come from more behavior change technologies sort of research. And this is so refreshing and insightful to look at it from the macro level, because that's exactly what's missing from what we're doing. So I would like to ask you, though, what could be the role of the individuals in working with the more macro level efforts? And what can support the individuals to help with the macro level efforts?
Well, given your background in technology, let me just think of it in terms of technology applications. Yes, the technology applications are all individual and behavioural. Many of them are behavioural oriented. The nice thing about that is the rapid uptake of them means that, you know, you can get a much greater picture of what's happening in a city. And so you get a macro perspective of it. I'm sort of saying it from a transport element. That's what I know most. We know that you can now influence driving behaviour using behavioural related apps. But those apps also provide us with a wealth of information around where we could reduce driving, target changes in our urban form, target public transit more. So that, we can scale up that individual level data to macro level. So there's enormous utility in all of it. And I think that's blurring the line, certainly, between sort of constantly focusing around individual and then the ability we have now of big data to look at the whole picture.
And I would just add that the scale of the problems and the scale at which the solutions need to be deployed is so great. Cities cannot do it alone. They need corporate partners. They need individual and community partners. 3 quick examples of where that's happening. Nashville has launched a Root Nashville campaign to try to plant 500,000 trees in the city. They're now launching a pledge campaign to get people and having, I think it's Lowe's that's doing free giveaways of trees to get people to plant trees in their yards because the city doesn't have enough public right-of-way or enough money to plant those trees. They need individuals to get involved to plant and take care of them. In New York, our Cool Roofs campaign, we used volunteers to paint roofs white on low-income and nonprofit buildings, and we needed individuals to decide that they wanted to take part in that program to coat their roofs white as people are going out redevelopment and renovating their homes. And then Paris and Barcelona are actually 2 examples of cities that have buddy systems where they ask you to sign up to check on a neighbor during heat waves, that there needs to be that social cohesion and network to take care of people. So individuals have a huge role to play. I think city government, local government can help raise the bar and give people platforms to take action on, but we need individuals, we need citizens and corporate and philanthropic partners to really lend the muscle for this work.
Hi, Jim Bueller here from Drexel. Every big city health commissioner could show you maps like the ones Dr. Farley showed, where the areas with higher levels of poverty have a greater risk of adverse health indices. And I wonder if you could speak to the evidence base or the experience in interventions like this that are specifically targeting low income neighborhoods, and how to make sure that happens in a way that doesn't accelerate gentrification, so that the people who you would like to see benefit from that aren't simply displaced to other places.
So one of the things that this particular project, but we've done it in other communities, revealed was a particular neighborhood in Santa Monica that was lower on some of the well-being outcomes. It was the Pico neighborhood, which has a high Latino population and is economically a little bit more distinct from the other neighborhoods in Santa Monica. And so there has been a great investment to try and engage that community, both in how to interpret the data and the information, but also how to use their insights in terms of investment choices for the city. Some of it around issues that might be considered gentrification or issues around residential and housing stability kinds of questions, but also putting them much more in the lead of the choices going ahead in terms of policies and resource allocation. And they're able to put a more holistic well-being lens on it to kind of leverage the assets of that neighborhood in terms of social connection, but to look at then the implications of some of the city choices on economic development and opportunity. So through pilot mechanisms, prototyping kind of investments, other kinds of things that the city is doing, they're trying to change that structure. But also the city is having a real conversation about power and structure, because that's obviously root to all of these kinds of choices and decisions. It's causing them to reflect, of course, on long-standing historical and structural challenges to really engaging certain neighborhoods as lead in their own decision-making and planning. So I think you're seeing that there, but you're also seeing that in cities everywhere, right? I mean, people are trying to, Government Alliance on Racial Equity and other organizations are going into cities to try and reimagine power structures. So Santa Monica's not alone in that.
Yeah, and a couple quick examples, and I think it has to start with first intentionality and recognizing that oftentimes trying to solve a problem can create others, and you need to think much more holistically. Washington, D.C., a great example was the 11th Street Bridge, a new pedestrian bridge that was created, that they incorporated a anti-displacement and community retention plan as part of that. Atlanta is now trying to replicate that with large-scale developments, saying that all large-scale developments, private developments, have to have a community retention plan that's part of the planning process and engaging the community to think about that. exploring incorporating that into public works as well for parks, and then thinking about mechanisms like also in Atlanta around the Beltline, the West Side Future Fund and Anti-Tax Displacement Fund, so that when property values increase, that their philanthropic and other funding can come in to pay the delta, so that the communities that are there that live through the tougher times don't get priced out. I think we need to be much more intentional and thoughtful about that, so that you can bring in new investments without displacing the residents they're meant to benefit.